talking about different treatments that may not have been seen as positive by the bureaucracy. For example, and there seemed to be almost a chilling effect between that patient-doctor relationship. The CPSO, which is the College of Physicians and Surgeons of Ontario, I remember they commanded Ontario's doctors not to make any statements that might be considered anti-vaccine or anti-masking or anti-distancing or anti-lockdown. And it forbid the promotion of any unsupported, unproven treatments for COVID-19. Doctors were even then forbidden to make comments that might encourage people to act contrary to the public health orders. And that included getting vaccinated. That is a very handed approach to me. That seems very heavy-handed. And it clearly impacted the doctors and patient trust.
Patients are furious at this. United States, we lost over 1 million Americans, 10 million hospitalizations. And I've testified multiple times in the U.S. Senate that I think if we would have had an all hands on deck, everything under consideration, doctors and patients working together for the best solutions, we could have avoided 2/3 of all that. And so during a time of crisis, when we're dealing with a novel virus, the last thing we need to do is wait for government narratives or government guidelines. The government is just too slow. It's not equipped to do this. Doctors in the field who are seeing patients firsthand and finding successful treatments, they need to be the ones to lead us through a pandemic, not government agencies.
But even here in Canada, sounds likewise in America, we did have doctors speak out and prescribe against, again, treatments that may have run contra to the public policy narrative, like ivermectin, like hydroxychloroquine, which were seen to be successfully applied in India, in Mexico, and numerous other countries. But again, those treatments were dismissed very quickly by the medical bodies. And even some of the doctors who prescribed those treatments felt that was most beneficial for their patients. They were quickly disciplined and in some cases had their licenses reviewed and perhaps even revoked.
This is an ethical issue. What people need to know is that there's always a community standard of care everywhere. And the community standard of care is established by doctors who are treating medical problems, and it varies from place to place, patient to patient. The community standard of care is what doctors find to be useful based on their clinical practice, their experience with the medical literature, and evolving information. The community standard of care is never established by medical boards, royal colleges. It's not established by government authorities. So there is an ethical duty to treat. And what we saw here is governments and medical boards and colleges were interfering with the doctors' their duty to treat patients and save lives.
And where does that leave us? It seems there's been a politicization of the medical and science community now. And in my view, and based on public polling, it's undermined the public trust in healthcare and healthcare delivery and the institutions and even the scientific communities. So how did you, or do you as a leader in medical science, because you are, fight the politics? How do you fight that?
Before COVID, I was already the most published person in my field in history. I studied heart and kidney interactions, so I was well positioned to take a lead on COVID-19. I did all the right things. I got research grants, investigational drug applications. I published my findings, established protocols, collaborated with others, repeated the process, again, showing cohesiveness, internal and external validity. I did it all to bring a message that COVID-19 should be treated in a fraction of patients who are at high risk. Others are going to get through it without any problem, without any medications at all. What we didn't have is we didn't have respect from our government agencies for those in academic authority in academic and clinical practice. We just didn't see the collaboration that we needed at the moment of truth.
And again, I'm going to ask why? Why was there no collaboration? Is it because things were moving so quickly? Was that the reason?
There appeared to be from the very beginning a top-down approach that was going to focus on one intervention, and that was vaccination. And I don't think any governments put any interest into early treatment. It was never featured in public service announcements, never featured in large research programs. There wasn't access to large randomized trials. We should have had dozens and dozens of clinical trials, over 20,000 patients each. There were so many sick patients with COVID. We could have had a massive government effort to treat people, the small number of people at any time with COVID. There was a much greater interest to vaccinate everyone as opposed to focus on the sick person right in front of us.
And we only have 15 seconds left, but had this been happened before? Is this typical of when diseases break out?
It's never happened before.
Okay. Well, we're going to pick up this discussion when we come back, and we're going to talk about the COVID vaccine. Please stick around.